There are a lot of misconceptions about what cataracts are and what cataract surgery really is. The most common misconception of cataracts and cataract surgery is that a cataract is a growth or a film or a membrane or a tissue or something that kind of grows over the pupil or over the eye, and then I would simply peel that membrane or tissue away and the patient would be able to see again. That's not actually what a cataract is, even though that's the most common thing that people think when they come in to see me. In reality, if you think of the eye as simply a camera and not the organ that actually sees, the organ that actually sees is the brain. The eye is simply the camera which takes the picture. And like any other camera, the camera has a lens in it. And that lens, over time, gets cloudy and dingy and dusky. It's not something that happens only later on in life. It's not the only part of your body that waits until you get older before it starts to age. It's aging from the day that you're born. And over time, that lens will get yellow and cloudy, and that's what we call a cataract. And so when a human lens gets yellow and clouded, there's nothing that we can do to unyellow it or uncloud it. So we replace it. So cataract surgery, by definition, for everybody, is lens replacement. And that's the reason why the lens implant that goes in the eye is so important, because that's what the patient ultimately is going to see with forever. There's other misconceptions about cataracts as well, that a cataract has to be ripe before you can remove it. I always jokingly tell people cataracts are not vegetables, they're not fruit, they don't get ripe. That's an old, outdated, antiquated terminology that is based upon the fact that the outcome of the procedure or the solution for the cloudiness wasn't much better than the problem itself. So you had to wait for the problem to become so bad, blinding in other words, before it was really reasonable to do it. Today that's not true. We can take cataracts out very early on if they're affecting how the patient is seeing and how they're functioning and whether it's affecting their ability to live their life the way they want to. So now we take out cataracts much earlier rather than waiting for the patient to become blinded by the cataracts. Another really common misconception about cataracts and cataract surgery is that the recovery period is hard or the surgery is painful. In fact, it's about a 5-minute procedure done with the patient awake but relaxed. And we give them a little medicine that I always tell the patient is called I'm aware but don't care medicine. And that always sets the patient at ease. And then they say, yeah, give me some of that. And then once it's done, there's no patch or shield over the patient's eye, and they go back to the recovery room, and probably within about 10 minutes, they're on their way home. There's no real restrictions on their activities during the day. This idea that you can't lift, bend, strain, or do anything like that is really a fallacy that is based upon surgery that was performed years ago. But with current technology and current surgical techniques, really the main restriction on patients' activities after the procedure is to make sure they get nothing in their eye except for their eye drops. At night, when they're sleeping, is probably my biggest restriction, and that's when I have them wear a shield at night for at least several nights, which stops them from rubbing their eye or sleeping on their eye funny. And if they like to sleep on their side, I always tell them to sleep on the opposite side. That's probably a bigger restriction than I give during the day. I've operated on a lot of people who are really visually dependent, surgeons for example, and virtually every surgeon I've ever operated on is back in the office the next day. That's how quick and easy the recovery from this relatively simple 5-minute procedure is.